Hi everyone, myself Krima Patel, and I am working on this presentation with my two other group members, which are Avnik and Manshi Patel. So let's have a look on the presentation. The presentation is about rickets. We'll be looking for rickets causes, symptoms, and management, and its bone health and the essential role of diet and sunlight. Let's go ahead. Introduction and overview. So, what is rickets? So, rickets is a skeletal disorder which is mainly caused by vitamin D and some other nutrients as well, like calcium and phosphate, which results in weak and soft bones, particularly in the growth of children. It is very common disorder due to inadequate diets and lack of sunlight exposure. Why is it important? Like why rickets is important, why we need to study that? Because it can result in long-term skeletal deformities if it is not treated well, and it is very common in children under the age of 5. It is preventable with proper nutrition, of course, early diagnosis, and sunlight exposure. Symptoms, causes, and diagnosis. So, the symptoms of rickets are bone symptoms, bowed legs, thickened wrists, and delayed growth. Other symptoms are muscle weakness, bone pain, and some dental issues as well. The causes, as I mentioned earlier, it is mainly based on vitamin D, like lack of vitamin D, and improper diet as well. And the other causes are genetic factors as well, like it may happen if the children's parents have the same disorder. It can come through genetic as well. And kidney or liver disorder. Diagnosis. We can get to know about rickets by some test, like blood test for low vitamin D, x-rays to detect bone deformities, and some physical examinations like observation of skeletal deformities and growth patterns. Management of rickets. So how we can cure it, like how we can manage the ricket. So the dietary management of rickets is increase vitamin D. Like we need to, it is the main cause of rickets, right? The lack of vitamin D. So we need to increase vitamin D in our diet through fortified foods like milk and cereals. Fatty fish and egg yolk is best for the vitamin D. We can have balanced diet, a well-rounded diet rich in fruits, veggies, and whole grains to support overall health. We can have some supplements in case of severe deficiencies. Vitamin D supplements, either D2 or D3, which are often prescribed to correct levels. Sunlight exposure, the natural, I guess, the natural way to manage rickets. The body naturally synthesizes vitamin D when exposed to sunlight. Aim for 10 to 30 minutes of sunlight exposure a few times a week, depending on skin type and location, of course. Sun exposure should be balanced to avoid skin damage or risk of skin cancer. Like it depends, like as I mentioned, it depends on the skin type and location, so we need to make sure about it. Okay, ahead of this, one of my group member will be continuing this presentation, and I'll leave you guys with him or her. So see you.
Hello, everyone. My name is Manshi, and I'm going to talk about the risk factors of the disease rickets. So, the first one is limited sunlight exposure. Low sunlight areas, staying indoors, or even wearing skin covering apparel reduces vitamin D production. Poor nutrition, deficiency of vitamin D and calcium in the diet due to the avoidance of fortified foods or limited access to nutritious meals increases the risk of having rickets. Darker skin. Higher melanin levels reduce the skin's capacity to synthesize vitamin D from the sunlight. Early birth or full breastfeeding without complementation. The nutrient stores are limited in premature babies, while vitamin D is low even in full breastfeeding unless complemented. Then next we're going to talk about the medical interventions. Uh, Firstly, supplements. Vitamin D and calcium supplements are the main medicaments to improve deficiencies and ameliorate bone health. Sunlight exposure. The skin manufacturer of vitamin D, which prevents deficiency, can be aided by safe sunlight exposure. Corrective surgery. Severe deformities may require surgery to restore normal bone structure and function. We're gonna talk about the prevention of the rickets. Vitamin D intake. Ensure that pregnant women and young children receive enough vitamin D through diet or supplementations. Fortified foods add vitamin D and calcium. Fortified foods like dairy, plant based milk, and cereals. We can also have a lot of sunlight exposure. Moderate outdoor activities increase the natural synthesis of the vitamin D. We'll talk about some follow ups. Early detection of deficiency or bone problems may be helped by timely intervention or cure. Complication of untreated rickets. So, growth impairment, which includes stunted growth, and skeletal deformities of legs or curved spine. Fragile bones, increased risk of fractures, bone pain, and reduced mobility. Irreversible damage. These are permanent deformities, can result to long-term physical disabilities. Thank you so much, Avnik. My friend will continue from the next slide.
Hello everyone, myself Avnik. Let's talk about importance of early detection. Promotes healthy growth. Early detection is rickets is essential for promoting the healthy growth and development of children. Early diagnosis help to address nutrition deficiency, preventing growth, delay, and deformities in bones. Prevents long-term complications. Family treatment is also critical in reducing the risk of permanent skeletal abnormalities and physical disability, which can significantly impact children's quality of life. Early interventions ensure that children receive appropriate medical care support, minimizing long-term health challenges. The third one is enable target nutrition. Identifying rickets early allow for personalized dietary plans to correct deficiency such as vitamin D, calcium, and phosphorus. Let's talk about global awareness of rickets. Prevalence and the risk factors. Rickets remain a global issue, especially in low income regions and among children with limited sun exposure or poor nutrition. Prevention and awareness efforts. Public health campaign promote fortified foods, vitamin D, and supplementation, and increase the sun exposure to combat rickets globally. future research and development. Ongoing research and advertisement are crucial for addressing rickets more effectively and ensuring healthier outcome for children worldwide. Here is an explanation of key focus on area. The first one is advancing diagnosis techniques. Development of more accessible and precise diagnostic tool to detect early sign of rickets, especially resort and limited settings. The second one is innovative treatment options. Research into improved supplementation strategies, fortified foods, and genetic therapy to address rickets effectively. And the last one is global prevention programs. Implementation of large-scale community-based interventions focusing on education, nutrition, and sustainable food fortifications. Here is some reference for rickets for better understanding. Thank you, everyone.